Hello class, my name is Emily Parsons, and for this week's discussion post, I will be discussing advocacy in relation to the nursing profession. Advocacy can be defined as promoting the best interests of the patient by ensuring that the patient's rights are being met and their needs or preferences are being supported. It is important for the nurse to understand their organization's policies and procedures to better protect the patient's rights while ensuring their safety. An example of protecting patients' rights could relate to the topic of end-of-life care, refusing treatment, or informed consent. Nurses who advocate for their patients build a better rapport with them, provide holistic care, reduce healthcare disparities, and improve outcomes. Nurses should advocate for all patient populations, especially the more vulnerable ones, such as those with disability, children, or the elderly. The traits that these nurses possess include empathy, assertiveness, compassion, integrity, and courage. They are also knowledgeable and ethically grounded. Nurses who do not advocate for their patients produce poor outcomes by chancing safety risks such as delaying treatment, reducing quality of care, lacking trustworthiness, or creating legal and ethical implications. Advocacy is a pillar of nursing and is something that all nurses should work towards. It is needed for delivering safe, patient-centered care. Recently, I had a patient present to the hospital who fell 10 feet from a ladder, sustaining rib fractures and a fractured shoulder. The patient confided in me that he had been sober from opioids for the past 9 years and did not wish to receive any narcotics during his stay. The provider entered PRN pain medication that were narcotics for pain control and a simple Tylenol. The Tylenol was not enough to control his pain, so I felt the need to advocate for my patient's rights. I contacted the provider and told him about the situation, and the provider appropriately changed his orders. We were able to successfully control the patient's pain without the use of narcotics, in which the patient was extremely grateful for. Besides advocating for patients, it is also important to advocate for yourself and for your colleagues. I feel that this is our ethical responsibility, and it is a profound way to promote workplace safety and well-being. Examples of advocating for yourself and others include pushing for better nurse-to-patient ratios, pushing for regular mental health support, and pushing for fair compensation. Nurses can also advocate for state and federal laws that pertain to their profession, which would empower both healthcare professionals and the patients. In conclusion, whether it be ensuring ethical treatment, influencing policy change, or promoting safer workplace conditions, advocacy empowers nurses to act with bravery and compassion. Thank you for listening to my views on advocacy related to the nursing profession, and have a wonderful day.